I'm Dr. Malik. Today we'll talk something about alcohol de-addiction. Alcohol de-addiction. So many people ask me, see, I want to stop alcohol. I have problem. I can't stop drinking. I want to stop it. How can I do it? This is the common question which is asked by so many people. For such people, this is very, very important. Alcohol de-addiction is there are so many de-addiction centers. There are so many de-addiction centers. Very good psychiatrists are there. They are maintaining the de-addiction centers, because this alcohol, it has got, see, if you are just like a party drinker, it's okay. If you are just having 2 packs per day, it is okay. But if you are regularly taking large quantity of alcohol daily, or you are taking it morning to evening continuously, so this is called addiction. There are 3 phases of addiction. Number 1, dependence. See, once you start taking alcohol, you slowly become dependent to it. This is dependence. Craving. Once you want to, that particular time you regularly used to take alcohol and you didn't take that day, craving starts. You look for it, you search for it, you take it. That is craving. Okay, your body gets used to it. And lastly, tolerance. Tolerance means, you used to take 2 packs. Slowly you went to 3 packs, 1 quarter, half bottle, full bottle, like that. You are increasing day by day, because that particular effect is not coming with that small quantities. Slowly the quantity is increasing day by day. This is called tolerance to alcohol. And lastly, withdrawal. What is withdrawal? Suddenly you stop alcohol for some reasons. See, if you are taking large quantities of alcohol daily, and if you are regularly morning to night you are taking alcohol, then only you are called an alcohol addict. Then only you are called an alcohol addict. You are not an addict if you are taking 2 packs per day regularly since long time, or you are taking occasional party drinker. It's not a problem. See, addiction is different. Addiction is daily large quantities of alcohol and morning to night taking alcohol. These are addictions. Okay, so once this withdrawal starts. Withdrawal means suddenly you go to one marriage, or you get admitted in a hospital. This is what daily we are facing. The patient is a regular drinker. Suddenly he has a hip injury, or he has a bone injury. We have to do operation. He gets admitted to the hospital. The withdrawal starts. He's not getting alcohol. The withdrawal starts. Horrible. That is horrible. We are facing very, very tough situations. Patients also becoming very, very uncomfortable. Okay, so this is called withdrawal. It occurs from 12 hours to 48 hours anytime. 12 hours, it can start from 12 hours, or it can start 48 hours after 48 hours. So there is, depending on the quantity you are taking, it can start after 12 hours, or it can start after 48 hours. And it will be just like this. What are the signs? Psychological, physical. Number 1, psychological. The patient becomes irritable. Anxiety, a lot of anxiety. Mood swings. There will be mood swings. There will be delusions and hallucinations. See, what are illusions, delusions, hallucinations? Like, for example, delusion. There is something there. There is a rope there. You think that it is a snake. That is illusion, delusion, or whatever it is. And hallucination is, there is nothing there, but still you think there is a snake. That is hallucination. These are something like these things. There is nothing there, but you feel there is something there. These are hallucinations. You will be thinking, your mind will be thinking that there is something there, there's something here, somebody is talking to you. All these things. So they are called illusions, delusions, hallucinations. Okay, and physical symptoms are vomiting sensation, nausea, body pains. The most common thing is your hands, your legs, your body. They start aching like anything. You feel like stretching your legs, body, etc. But there is nothing. That is uneasiness. Uneasiness will be there, and tremors. There will be tremors of the hands and body, total body, and Delirium means you go to a situation where you don't know what you are doing and where you are. You don't know where you are and what you are talking. You don't know anything. This is called delirium. You are talking something. You are not in a state of consciousness. You are in a state of semi-consciousness, or you are what you are talking, what you are trying to say, or what other people are trying to say, you can't understand. You are speaking something nonsense. Your actions are nonsense, and you don't know where you are. You are in the hospital or you are at home. You are very, very uneasy. You can't lie down on the bed. You are getting up. People will have to hold you. These are delirium states. And lastly, you can have fits. These are called some rum fits or something like that. Okay, so you need de-addiction centers. You need de-addiction center at this time. This de-addiction center will help you in this particular. Psychiatrists, they are having de-addiction centers. They are helpful at this state, provided you want to come out of alcohol by yourself. That is very, very important. You want to come out of alcohol by yourself, then de-addiction centers are very, very, very useful. For example, there are two stages in your de-addiction. Number one, detoxification. First, detox. First 1 week to 2 weeks, they try to detoxify you from alcohol. The alcohol craving, the alcohol dependence will be slowly reduced by some medicines. You will be in the hospital for 1 or 2 weeks. 1 week if it is mild, 2 weeks if it is more. So some benzodiazepines like injection Compose, tablet alprazolam, tablet alprox, tablet Valium, injection Compose. These are the things, benzodiazepines, they give so that you remain calm, comfortable in the bed. And sometimes if it is severe, you are getting up, you are violent, then we may have to resort to antipsychotics. For example, injection Serenase, that is haloperidol, injection Serenase. There is one injection Serenase called haloperidol. The drug is haloperidol. It will be given along with Phenergan, injection Phenergan. We have to resort to it to control your aggression. And liver tests, blood tests, these are done to say that how your body is. Next stage is maintenance stage. They check your psychological status. They give you counseling. They motivate you. Psychiatrists, they motivate you, and they lessen your craving for alcohol by some drugs. See, this is acamprosate. Acamprosate is a medicine, 300 to 600 milligram daily. Acamprosate is a drug which decreases craving, 300 to 600 milligrams per day they give. And relapse prevention, again and again taking alcohol, relapse, it will be prevented by using naltrexone, one medication called naltrexone, by the dose of 50 milligram per day for 5 to 6 months. It prevents relapse. Again and again you are going for alcohol, that will be prevented. It prevents. This naltrexone tablet, that is medication for about 50 milligram, 5 to 6 months. And eversion to alcohol. The moment you take alcohol, you see alcohol, you develop, say, no, I don't want it. That is called eversion. How do you get it? Disulfiram. There is a drug called disulfiram, 250 milligrams to 500 milligrams per day. This causes eversion. Eversion means once you are taking this drug, when you take alcohol, you definitely feel very, very uneasy. Very uneasy, rashes over the body, vomiting sensation, etc. All these things you get when you are taking disulfiram, 250 milligrams to 500 milligrams. So these are all the methods they use for detoxification and de-addiction, and preventing craving, preventing relapse rates, and preventing again you not to go for alcohol, etc. There is another important thing called Alcoholics Anonymous. Alcoholics Anonymous. This is a group of people. This is a group of people, about 7 to 8 people or 10 people who were in your situation previously. That means they were a businessman, they were doctors, they were professors who were alcohol addicts previously. They came out of addiction and they are now successful in their businesses and their professions. They come to you daily in the evening to the de-addiction center. They talk to you, they sit with you, have some snacks, and they talk to you for 1 hour. Their experiences of alcohol addiction, after coming out, after de-addiction, how their life improved. Daily they talk to you for these 1 to 2 weeks so that you will slowly change psychologically. This is called Alcoholics Anonymous group. They are very, very important in counseling you. So please take this seriously. Alcohol is damaging people like anything. It is disturbing relationships. Usually, alcohol addicts, what I see is they're suspecting their wife, they're suspecting their spouse. The reason being is not they are good by nature, but because of alcohol's action on their mind, the suspicion on the wife has increased by anything. This is very common in alcohol addiction people. So daily quarrels, daily problems in the house, financial problems, social problems, you know what are all the things, you get it. So please, as early as possible, try to get de-addiction done. Once you got addicted to alcohol. And what is addiction? I told you, it is not like a party drinking or 2 pegs per day. It is not called addiction. That's very, very important.